Welcome to the latest episode of Lateral Think, brought to you by Melbourne Athletic Development. Melbourne Athletic Development is a sports and injury management clinic based in Melbourne, Australia. To maximise your performance, optimise your injury management, contact the team at Melbourne Athletic Development. Hello and welcome to another episode of the Melbourne Athletic Development podcast. Jack?
John?
Today, we thought we would explore a topic that we started to get into at a reasonable level a couple of weeks ago. But we thought we would explore it a little bit more from some of the ideas that you put forward actually in one of our professional development sessions with our clinical group, which was about how psychological stress actually has a physiological effect and what it actually does to our biology.
Yeah, and this is a topic that, actually interestingly, there's a lot of really interesting research done on it, but I think sometimes can often be overlooked of how significant it is.
Well, I think the reason that I think that happens is because it's like this thing of like, oh, well, psychology cannot affect my physical health, or it shouldn't. And so people want to make out that it doesn't contribute to things like injuries or recovery times or those kind of factors that you think, well, those are physical factors. But it seems like that's not actually always the case because the intertwining of physiology and psychology is very, very strong.
Yeah, and just to give an example of that, a paper I shared in that presentation I think really highlights this in quite a profound way of looking at how people who are optimistic and have a will to live actually live longer.
Why would they have a will to live, Jack?
You don't have a will to live?
I don't know. If you're reading Nietzsche, you might have a will to power.
Well, look, the point here is that simply your view of yourself and whether you tend to be more of a positive, have more of a positive outlook or a negative outlook has significant implications for the outcomes that you have in terms of just lifespan. So they found that people who have had a positive outlook lived 7.5 years longer, which
is a very significant amount of time.
Exactly. Yeah. And this is where I think it's a good place to start is we need to think about what stress is and think about the physiological and potentially pathophysiological impact it has on the body. Because stress is something that we actually need that allows us to create behavioural or physical change and allow adaptation to occur. And what's important to understand that when we think of stress, it could be mechanical. So we talk about this all the time when we think about exercise and adaptation to exercise. But it's not the only type of stress. There's other things like chemical stress is another key one. But the other one is psychological.
And I think interestingly, in certain areas of health, people recognize, even at I think at a general populace level, people, use it almost as colloquially in conversation around the idea of, oh, well, we know that stress contributes to heart attacks and things. Oh, they worked a very stressful job. They were really healthy, but they had a really stressful job. So people kind of recognize that, yeah, okay, the psycho-emotional stress associated with a profession that is very busy or has lots of responsibility or has to deal with a lot of emotional turbulence actually does lead to potentially poor health outcomes. Yet we don't necessarily see that being represented in other areas of health where that association is not always being made.
Or at least not really highlighted. And I think part of that too is dependent on the individual, the individual health profession's own experiences or even just where they are within their career. Because I think of, again, just even for myself, when you graduate, you hopefully feel like you know nothing. You try to start developing knowledge, but you try to keep it simplistic by using that very mechanical model in physiotherapy. So what's the injury? Can I diagnose this? What are the key mechanical factors I need to address? And those are certainly very important. But then as you get more experience, you start to realize, why didn't I get the outcome that I always wanted? And this sort of branches out into many factors, not just physical, but also non-physical, one of them being related to the psychological or emotional state of an individual, in addition to other things that we've talked about with sleep and diet. But the thing that's very interesting to look at is when you think about psychological stress, the actual physiological impact that has on the body is very similar to physical stress with regards to the neural and hormonal changes. So think of the autonomic nervous system. You've got your sympathetic chain, your parasympathetic chain. Most people are familiar with those two, with that fight or flight response. And one element of the stress system is what's called your sympatho-adrenomedulla axis, which causes the secretion of...
a couple of times.
I struggled enough to say it then, which secretes things like noradrenaline that helps upregulate your system. And then the other one is the hypothalamic pituitary adrenal axis, which again is also quite a mouthful, which essentially describes the connection between certain parts of the brain to the adrenals that also secretes glucocorticoids, things like cortisol. Yeah. If you have a physical stress or a psychological stress, both of these systems are upregulated, so you're getting a similar response, which in acute intermittent amounts is actually quite beneficial.
Well, I think that's the interesting one, because I feel like terms like cortisol has become more popular, particularly in health circles, but there is not always a recognition that cortisol is important. And even in your noradrenaline or norepinephrine, these things are actually vital for the messaging that occurs within these autonomic nervous system functions.
Yeah, I think it's a similar issue you see with, say, like type 2 diabetes and insulin resistance, that because excessive expression or secretion of insulin is associated with metabolic syndrome, that insulin is bad, yet actually intermittent bouts of insulin increase are necessary and vital.
You need to have that sensitivity in your insulin response, don't you?
And that's similar with cortisol, because one of the acute effects it will have is it will help suppress the immune system, which actually can be beneficial in the sense of it can essentially is almost anti-inflammatory in nature and helps to maintain your ability to continue with doing a particular activity without becoming symptomatic or your immune system being compromised. The issue is if that's chronically elevated, you're going to start getting resistance to cortisol itself, so it doesn't actually have that positive effect of being able to regulate your immune system. And this is something that we see happening a lot now, because when we think about psychological or perceived stresses, that's becoming more and more abundant. Part of that has to do with your mindset, but also part of it has to do with this even environmental stresses too, when you think of, say, like light exposure or noise exposure or sleep deprivation as well, which are all factors that continue that excessive elevation of the stress system.
I think we spoke about this with Mark Matson, but I think it's one of those factors where if the stressor is acute and then there is a period of recovery or removal of that stress, the system does have the opportunity to adapt to it and or improve its capability of dealing with whatever that stressor is. The problem becomes when it's consistent, unrelenting, and potentially even increasing over time. You will get maladaptations that start to develop, and consequently your health, your ability to deal with other types of stress, say mechanical stress, goes down, and the likelihood of, in our world, of injuries from mechanical stress, such as physical injuries, goes up.
Yeah, and essentially what we're describing here is the idea of being exposed to stress is almost like a bucket, in the sense of it doesn't matter if it's physical or psychological or some other environmental stressor. If you're applying lots of stresses to the body and that bucket fills up too quickly, it potentially then overfills and becomes problematic.
I always think about it like a bucket with a hole in the bottom.
Actually that's a good way to describe it.
And if you're really good at dealing with stress and you've adapted a lot, you might have a big hole in the bottom of the bucket, and if you haven't, you've got a small one. And so it doesn't matter what liquid you're putting into the bucket, whether that's physical stress, psychological stress, emotional stress, other factors. What ends up happening is, as you said, if it doesn't drain out fast enough, it overflows. And if it overflows, then usually you get some sort of health ramification or injury or major performance decrement.
Yep. And I think setting the basis for this conversation, one of the interesting things to consider is how your psychological stress or perceptions actually influence the manifestation of how you adapt to other stresses, like mechanical stresses, i.e. exercise, training, and even potentially the potential to develop like disease states too, actually becoming unwell. And this ties into what you call the placebo, or what also can be potentially the nocebo effect. And most people have probably heard of the placebo effect. And interestingly enough, if you look at any study where they've got a control group, particularly in like drugs or pharmaceutical studies where it's easy to do a placebo, that is, give someone a drug with no active substance in it, you always see potential improvement in their physiology. So like, it could be anything, it's like this drug's meant to reduce your blood pressure. You give someone an inactive substance, but you actually see a reduction in blood pressure still. And like we see this also like within our profession when you think about exercise interventions. You could be giving someone a generic program for, say, reducing hamstring strains versus a more hamstring specific program, and you'll still see some reductions from doing that generic program. Part of that's probably because you're still getting actual physical adaptation, but part of it is because if people perceive that to have a positive effect on their outcomes for developing injury, they'll actually manifest that into existence.
Well, I think the interesting part about this, because and we discussed this a bit in the last week or two in preparation for this, but I think is the fact that depending on the position of your mindset in relation to that factor, so am I going to, get injured again after having a hamstring strain? Am I going to significantly, not only is it from, as I said, that placebo effect, I think it's really interesting because I think it very heavily influences the behaviors that you put in place. And, this brings up ideas of, of internal versus external locus of control. If you think that you have very little ability to influence an area, so your internal locus of control is low, or you think that external factors are the major things driving it, then you won't necessarily believe that you can affect this in a positive manner. And if you don't believe you can affect it in a positive manner, the behaviors that you adopt will not necessarily support you getting a positive outcome.
And even at a cellular level, you see epigenetic changes based on whether you perceive something to be positive or negative. So like if you think about exposing yourself to any type of stressor, part of that adaptation requires you to upregulate certain genes that helps provide the signals to lay down new tissue if we're thinking about exercise or doing like resistance training. But part of that is also regulated by your belief systems on that stressor itself.
And to me, that seems wild. Like, that seems crazy.
Yeah.
That almost seems like it's, spiritual, woo-woo, like fantasy stuff. And I know that there's research that actually is demonstrating this kind of physiological change, as you said, at the genetic level, but it doesn't intuitively on the surface, particularly for someone who is logical and rational, that seems like it's a bit far-fetched.
Look, absolutely. I mean, you're going into... It really epitomizes that idea of the mind-body connection. And I think there's issues with that term because it's typically associated with like woo-woo, with spiritual, with something being hippie, but it is actually real. I think the issue is how far you take that particular idea or concept. But again, like just even thinking about it from a scientific perspective, it's very interesting to look at the impact of beliefs, particularly with all the testing that's done on genes and DNA. So if you think of anyone can get now gene testing done, it's pretty cheap to do. And you can then identify potential single nucleotide polymorphism. So that's certain polymorphisms in certain genes that are associated with an increased or decreased risk of disease states. And again, just thinking about the presentation I did recently, there was a study I reviewed which looked at when you get a group of people and you tell them that they have genes that reduce their susceptibility to obesity and also increase their satiation, so they feel less hungry. Even if they don't have these genes, you see physiological changes.
It's just insane that effect can happen just by telling someone you have this special gene.
Totally. And like there's a few studies looking at this where you actually see physiological changes when they exercise. So if they believe that they have quote unquote more positive genes, you'll see that they have better cardiorespiratory function during exercise. They'll eat less if they think that they've got genes that help with reducing hunger. Or again, another very interesting study done in the 2000s of just telling people that they're doing enough exercise without creating any actual change in their physical activity, just only changes in their perception that they're doing enough creates weight loss and changes in
that was that study, wasn't it? Of they used it within cleaners, wasn't it?
Yeah, correct.
So they told, there's a really good study where they had a group of cleaners that worked in like an office building, and they told one half of the group the physical activity that you do during your job with your function as a cleaner is more than enough physical activity to improve your health and, like lose weight.
Yep.
And then the other group, they said it's not enough. You're not necessarily covering off.
Oh, no, the other one, there was like less set as a control, so they weren't told anything. Yeah. But yes, it's if anyone's interested, it's a paper published by Crum and Langer are the two authors in 2007. Okay. But yeah, and within 4 weeks, you saw reductions in weight, you saw reductions in blood pressure. They didn't have any change in their physical activity. They didn't have any change in their diet or any other environmental factors.
Yeah, they were just told that what they were doing was like more than enough physical activity.
Absolutely. And the reason to highlight these goes back to your point of thinking, well, how do people's perceptions of themselves influence their future outcomes? And I think this is really relevant when we think about whether it's athletic populations or just general populations who have musculoskeletal injuries, is if someone has experienced a very significant injury before, a hamstring strain, whatever it may be, and they've had a prolonged period where they haven't been able to perform at the level they want, what has their psychological profile changed? And if so, has that changed in a negative way that then impacts their particular behaviours of how they actually approach training and performance? But also too, even at that more conscious level of how does it change their ability to perform in certain contexts?
Well, I think that thing is huge. And it's interesting having these discussions even with some of the athletes that I coach, like how their perception changes over time. Some athletes have had lots of injuries, and when they were having those injuries, the perception of their body was that it would fail them at a certain point. And then having some of them come into our program and, you put in place behaviors that you hope to reduce that. And now they don't believe that their body's going to fail them. In fact, they see themselves as being quite robust. And that's a really interesting thing. And it's, as you said, it's kind of the chicken or the egg. Do you, if you believe that your body will fail you, do you start actually, behaving in a way that actually increases that? And does that psychological kind of fear lead to some of these changes that you're talking about at a physiological level that may actually reduce their likelihood of being able to tolerate certain mechanical stresses?
Yeah, and look, just based on personal opinion, I think it's probably bidirectional in the sense of you can consider and reflect on your own perceptions and beliefs of yourself. But I think also too, part of the thing that changes your psychology is how your experiences over time influence that as well. And this is an interesting question itself, because part of this comes back to then what kind of mindset do you have? Are you someone who has more of that growth or adaptability in your ability to change your perceptions of yourself and reality? Or are you someone who's more rigid and is fixed, not so open to the idea of change?
Yeah, these ideas of like growth mindset, I think we've spoken about it a number of times. The work that was popularized by Carol Dweck. And I think one of the interesting parts of this is that we all have different perceptions in relation to different areas of our life. So, for instance, I tend to think that I have quite a significant growth mindset when it comes to most things in relation to learning. However, I've mentioned it on here before, I'm not musical at all. And if you ask me, do you think that you could learn an instrument? My idea is probably not, right? And because of that, I will never learn to play an instrument, right? I'm pretty fixed on that, which is quite funny because I think that generally I'm quite open to changing when in relation to learning. But with that, I just don't think that I'll do well with it. And for that reason, the behavior is that I don't try to.
Well, I think what you highlight here is this idea is very contextual.
Yeah.
And this is something that, again, there's some interesting literature and thoughts about this, of the self in context. And I think that's actually an important thing, because you might see yourself as, like you said then, of like, no, I'm a pretty open-minded person. I really much have that growth mindset, which I think is fair with regards to what you do in your professional and personal life in many ways. But then when it comes to something like music, it's like, I can never learn an instrument. And it's interesting, well, how does that actually work? Because aren't you contradicting yourself in that statement? And this is where it's really important, because I think, again, from an athlete's standpoint, and you'll be able to touch on this more than I can, but you'll have conversations with some of your athletes and they'll go, yeah, I have a positive perception of myself. I believe I can achieve these goals. You can see that in their training. But then what actually happens when they get into the competitive situation and environment? Because the reality is they may be saying all the things and doing all the things that you want and expect in a training environment, or at least when you talk to them, you can see that they have a genuine belief in their ability to achieve the goals that they want. But then when it actually comes to the performance side, there's a change in their psychology, there's a change in their emotional state. And this is where we need to really think about, like, well, what's actually driving that too? And there are some obvious ones of like, well, what are their prior experiences like? And I mean, this is really going down the rabbit hole here where we can think about what are their prior experiences in terms of performance. But then, there's even the potential to go back to thinking of like, what was their childhood like? What was their actual upbringing like? And this is sort of getting into realms of, or areas that we can't really, like, we don't have a professional
can't comment on it. But I think it's one of those things that but it is something that you deal with as a health professional in terms of injury, for instance, because you don't want to undermine someone's previous experiences when it comes to having an injury, right? If you haven't had an ACL injury and you're telling someone, oh, you'll be fine, right? In your professional experience, you understand that based on these factors, you're meeting these targets. The reality is you will be able to return to sport or do whatever the task is that's set out. But in their mind, they're saying, well, I've had a few knee injuries and then I had an ACL injury and maybe my body's not actually capable of that.
Yeah. And look this happens all the time. And sometimes there are things that are out of your control. Like I think of someone we know who has been going through an ACL rehab process, was getting towards the end, getting back into their sport, and then they had a traumatic injury where someone else took out their other knee.
Yeah, their uninjured side.
And then ruptured the other ACL.
Yeah.
And it was like one of those situations where you go, one, I feel so sorry for this person, but two, it's like that was really out of their control. But how does that influence that person's psychology moving forward now that they've got to go through the whole process again? And
on the other leg.
It's like... Yeah, this is where it probably can become challenging of like, what is their ability to actually be able to return at a high level? And I'm not saying that they can't, but it takes a certain type of character to go through two significant injuries and probably now looking at multiple years and not being able to compete and actually get back to the same level or potentially beyond that.
The thing that I think is interesting about this whole, and you made the point there of how strong can you be in maintaining that psychological state of whether it's growth or challenge or belief that you can attain something when the external result that you're getting is potentially negative. As you said, just with that example there of, I can return from ACL injury, I can do that quite well, I've learned a lot through this rehab process. But if that happens to you, do you then change that perception? As I said, is it contextual to the fact that you were close to the end of one rehab and you weren't expecting to have a second one on the other leg?
And then and these are situations where it's understandable to feel somewhat pessimistic, but if you have those negative thought processes, again, thinking about what psychological stress does to your body, you're creating potential negative or at least muting the ability to have positive adaptations to other stresses that you're exposed to with regard to, say, exercise or rehab. And so, I'm not necessarily saying there's any easy solution to this, but if you don't consider with the person in front of you of like, how does this person actually think? Like what actually goes on in their head from a day-to-day basis? And not just, again, what they tell you or say to you when you speak to them, but when they're by themselves, when they're at home, they're alone.
I think the thing that you start to notice is the behaviours are a reflection of what they do think. The underlying, I read a book now, and I'm going to forget who the author was, but it was a psychologist who was talking about this, and the context being that his whole methodology for working with particularly athletes, he was more in a sports context, was you have a set of beliefs. Those beliefs influence how you think. The way you think influences how you behave. And so in order to get an idea of what someone thinks and believes, watch what they do in their behaviours. And then if you want to start influencing the underlying belief, you kind of have to work backwards. Change the behaviours, change the way that they think, and put strategies in place to actually, alter their thought processes, and like in the long term, the aim is that will actually start to shift the belief that they have, because those two things will culminate actually in results matching what that behavior and thought reinforces.
Is that something that, like I know that you have had some experience working with sports psychologists? Are these kind of the principles that they apply in their practice?
Some of them do. I think it depends on the type of psychologist.
Okay.
I think the thing that I've really struggled with, and I know I've brought this up a number of times working with psychologists, is, and it's not even actually to do with psychology, it's actually to do, I think, just with the way in which a lot of sports systems work, especially in Olympic sports, where they don't have the funding of, say, like a team environment at a professional level, but is that everything becomes siloed. So in my mind, the way that it kind of has to work, and you mentioned this, like you don't know what they're doing outside of even the time you're training with them, but if you want these things to work, whether you're a health professional or whether you're a sports performance professional, you kind of have to, everyone has to be on the same page. The message has to be the same, and it has to be in real time that these things are being discussed and behaviors are being put in place. Like there's no value in having a session with a psychologist where you go through things and then only in certain contexts do they actually put in place these strategies and behaviors.
Yeah.
It needs to be consistent and ongoing, because, I don't know the actual statistics, but, there's always people saying different things about habits and how long it takes to form a habit and how many, repeated trials of doing something before that actually becomes an ingrained behavior.
Yeah.
And those things just need to consistently be applied by everyone around that person.
And look, you make an interesting point there, because we talk about these topics and we'll often say, like, look, this is something that we have to be cognizant of, but also be respectful of what you can or cannot do based on the parameters of your profession. But at the same time too, it's like you just highlighted there, of everything that you say influences someone's psychology. Yeah. So to suggest that it isn't actually relevant to us is misleading, because the language that we use and the things that we say impact the outcomes of the people we work with.
Well, I think that the best people I've worked with understand acutely the iatrogenic effect of communication. If you tell someone, and this is one of the ones I know that you and I get frustrated with, someone goes to see, say, an older patient, they go and see an orthopedic surgeon, and they use the phrase bone on bone. That's a disastrous thing to say to someone.
Yeah.
Even if you do feel like, one, it's unlikely that that's actually the physical pathology that's going on.
Yeah.
The big problem that you've got is their belief system is now one in which the pathology within their joint is so poor that the likelihood of improvement is low.
Well, and how often do you see this where a patient comes in with that perception, and your ability to do anything is limited because their behavior has changed based on that negative connotation they have associated with the description of their pathology. But then two, their ability to think that they can get positive changes even though they've had long-term pain, also becomes quite muted and dulled. And this is, again, it's quite interesting. I always think of the willingness of people to take on doing physical stresses, but then perhaps not willing to change their beliefs or mindset. And I think this is a key issue, because we are all guilty of the fact that we want to protect our own ego.
If you're happy to indulge me, I'll go on a bit of a rant.
Oh, please do.
So I think that physical challenges that people take on are vastly inferior to psychological challenges.
Yeah.
And I think that people pat themselves on the backs significantly for the physical challenges. Oh, I'm doing a marathon, I'm doing an ultra, I'm doing a triathlon.
The epitome of like physical challenge of doing more endurance or ultra endurance type events.
And I think that that's a low level of success when it comes to challenge. Right now, it's not that it's what they do is not impressive. I'm not saying that it's not, but I don't think learned suffering from a physical standpoint is easy. Right? To put yourself in a physical discomfort and then learn to be able to endure that I actually think is very, very easy. putting yourself in a psychologically uncomfortable state repeatedly is much more difficult to me. And I'm not saying in terms of like you're not being tortured, right? What I'm talking about though is even, for instance,
or just confronting issues that you have.
Or like the example I'll give is, say, for instance, for me with learning an instrument. That is psychologically scary to me because I know that I will initially be quite poor at that skill.
Yeah.
And the repeated behavior to turn up and practice a skill that I'm not good at, I think is something that most people give up on really quickly. And I'm always way more impressed with someone who shows little aptitude to start with, and the thing that allows them to get to a high level of performance is actually perseverance through the period where psychologically they're probably getting the message from themselves, you're no good at this, give up. That to me is way more impressive.
Well, just to give another example of that point that you see time and again, I see that a lot with people's resistance to stretching. And I think stretching is a bit different to other forms of physical activity because it's painful, but it's not so much the physical pain. There seems to be very much, well, no, really, there seems to be almost like this visceral, emotional related reaction to stretching out the body. And I mean, we can get philosophically thinking about, again, mind-body connection and what that means. But I think the other great example is something like other mind-body techniques like meditation. And again, you know, we can... That's a rabbit hole in itself of like, what is meditation? Is it worth doing? But most people will put up a wall straight away to go like, oh, I can't do stretching, I can't do yoga, I can't do meditation.
I can't hold that for, a minute. I can't.
Totally.
It's too uncomfortable.
The way I look at it is, does anyone start going to the gym and go, you know what, I'm going to do a 150 kilo back squat on my first session?
And but even then, the interesting part is, if you ask someone who does squat twice their body weight, what it feels like while they're doing it, it's not a particularly pleasurable experience to do a 1 RM squat, right? While you're doing it, you feel like you're being crushed, like physically, and it hurts, right? Now, that's obviously transient, which I would say is probably similar to something like stretching, yet someone will happily accept that they're going to push themselves into a very uncomfortable behavior for the period of time that it requires to do that squat, but not for a similar period of time to stretch.
Yeah, and like the reason why I use an example of something like meditation is because it's very much a mind exercise, so to speak. And there's that resistance straight away of like, I can't do that. And it's like, well, maybe the starting point for you is just literally sit down for a minute. Like, and that may be the starting point. It's like if you were going to start doing you wanted to run for a marathon, you don't start running by doing 40-kilometer runs. But I think some people put up that resistance straight away because, again, it's almost protective of the lack of or openness to actually create mental changes within their belief systems.
The interesting thing about that, I think, and this is an interesting thing to say to someone, I've had this in the performance setting of coaching, but even I think you see it quite a bit as a health professional. When someone does have a belief system that, say, for instance, they're injury prone.
Yeah.
When you say to them, okay, well, how about you change how you perceive that? They hold on to it like it's, a baby's blanket. And if you actually are willing to push them and you say, okay, well, if you're not willing to give that up, clearly you do not want to be healthy. They will fight you as if you've, tried to murder their firstborn, right? Which is very interesting.
Yeah, and again, it's interesting because, again, there's that protection we want to protect our identity, so to speak. It's like if anyone says to you, oh yeah, by the way, do you notice that you could be anything, like you can be really dismissive when you talk to someone. Like, no, I don't. What are you talking about?
You just did it again.
But like it's something that for some reason we take it much more personal when it comes to our personality than it does, like, say, with our physical appearance. I mean, don't get me wrong, people get defensive about their physical appearance as well and protective, but there typically is more of an openness to do that. And it's interesting because, like you mentioned before, some people are very willing to push themselves physically. They may not be willing at all to create any changes in how they perceive the world, how they perceive themselves, or how they actually even behave.
Well, on this, how do you think that as health professionals, as sports performance professionals, we start to change that behavior? What are the strategies that we can start to elucidate? Because it may require significant input from someone like a psychologist or psychiatrist or someone who's involved in that. If, as you mentioned earlier, if the past experiences that they have had are very negative and they do need to actually work through those experiences. But if it's, say, for instance, someone who hasn't necessarily identified into any of those and they're just having persistent, say, injury problems, and you think there's behaviours that are driving this, and I think it's the way that you perceive the influence you can have on your behaviour. How do you think that we actually go about starting to address that? What communication, what conversations are we having, what strategies are we putting in place so that we do see the changes in both their thoughts and their behaviours, so that it's not that we all know we can't eliminate all injuries. We just spoke about that patient of ours that had an ACL rupture on the opposite side, and that was a contact injury. Sometimes you cannot control that if someone takes out your legs during a game. What are the things that you think that we start to do? And from my end, it's like I think it's as simple at the start of actually just asking some questions to open the conversation.
Yeah, and I think first thing is identifying, is that an issue in itself? And like sometimes I think particularly the more experience you have, there are qualitative elements to how they articulate themselves, how they describe themselves and describe their lifestyle. That gives you indications of whether there is issues associated with their behaviour and perceptions. There are other ways we could do that too. Like I think actually some questionnaires can be quite useful at that too, just to get an idea of how they perceive themselves, how they perceive their injury, their openness or perceptions of, whether they can go back to work or sport based on their current presentation. But I actually think a really good starting point, particularly for people who have difficulties making any change, is actually asking, what do you think is something that's realistic for you to change? Because that could be something very simple, something that actually may seem somewhat trivial, but actually leads to a positive thing. So like that could be something as simple as, all right, this is what I want you to do as a part of your rehab program. Independently, all I want you to do is one thing. Just one exercise per day, every day between now and the next week. Something that's actually realistic with their ability to actually achieve that goal. And that could be related to like doing something physically. It could also be related to doing something with regards to changing their psychology, changing their belief systems.
Well, I think that it's interesting, as I said, I think sometimes you have to attack it from different levels. And obviously the guest that we've had on, Marco Keogh, psychologist, I spoke to him a fair bit about some of this. And obviously he mentioned in the podcast that he operates very much from that, the ACT model, acceptance and commitment therapy model of psychology is something that he uses quite a bit. And one of the things that we spoke about was understanding that sometimes the thoughts that you have about something are not necessarily accurate, and accepting that. Sometimes if it's a performance thing, like if you're very nervous, and you're doubting yourself, it doesn't actually match up with your capability. And there's probably almost no evidence to suggest that you're going to underperform. You may have performed really well, or you may not have been injured 99% of the opportunities you've had to play your sport, yet your belief is I'm going to get hurt if I go out there. And understanding and being willing to accept that actually the thought that you have is not necessarily accurate.
There's actually a good question to think about then is like, what do you think is acceptable in terms of the percentage of achieving the performance or outcome that you expect? Like, is it 50%? Is it 60%? Is it 95%?
I think it varies from person to person, but I think from a and like I don't know that there are statistics on this.
No.
I think within your own group you could probably, and the people you deal with, I think you could probably come up with it. But my personal opinion is it's probably at least 90%. There's probably 10% of the time where, you underperform and you're not really 100% sure what the factors that went into it.
That's an acceptable amount in that sense of...
Yes, it's a difference between sort of, I had this discussion with some of my athletes recently of the difference between prevalence, being 90% of the time you should be able to do it, and influence. It's like, how much can you influence something? Well, some things it's probably 90%, some things it's probably less. You know, if it's your height, then that's pretty genetically determined. You know, you probably obviously can eat healthy from a very young age and get lots of nutrients, but, you know, people who know me and how small I am, right, I was never going to be 6'5". I could have, I don't know, done all sorts of things. I was not going to be, even if they had had that crazy Russian surgery where they cut your shins in half and stretch you out, I still wouldn't get to 6'5".
Yeah.
So that's obviously something I can't influence to say 90%. But I think performance is probably something that you can. And there will be underperformance at times. So that's the prevalence side. And then I think with that, prevalence and influence are probably similar. But with height, for instance, like prevalence is obviously, you know, distribution across ethnicity and genetic profiles.
Sure.
And I don't know exactly what it is to be 6'5", but you're probably in the upper,
standard deviations.
Yeah, the upper
from
standard
average,
deviations. You'd probably be at least 2 standard deviations above normal.
Yeah.
Which puts you in the, you know, what's that, the last couple of percent?
Yeah, 2.5, isn't it?
Yeah. But you're not necessarily able to influence that to a significant level either. So, you know, that prevalence and influence on that is lower. With performance, I think it's probably closer to 90%.
Yeah.
And
actually, I think it's, I'm thinking in my head, I'm pretty sure 2 standard deviations above is 1%. Not that it's ever that important. Let's not detract from the conversation.
Yeah, you got to remember the distribution.
Yeah.
Each standard deviation.
Well, actually, another thing I thought of then too is it's very easy when someone has an outcome you don't want to go like, you know, what is it that went wrong? What is it that you didn't do? And it could be like, I just didn't execute. And you can explore that thinking of like, well, what is it that was actually going through your mind? How did you approach this? What was different now compared to the previous time if you performed well? Do you think actually you need to go through that same reflective process when you perform well? Because, you know...
Yes. I think this is the key. Like, you've made a really good point, because I think this is the key thing that you see. I'm going to bring up something in a moment that I left out of the conversation just then. But one of the key things that I think is really, really obvious observing people who consistently get results in a particular area is they're very reflective. They're reflective about the negative things that happen, and they're very reflective about the positive things that happen. And they are, in an interesting way, they're often unemotional about the depth in which they go to that reflection. Now, it's not that they're unemotional about the result. Don't get that mixed up. So they'll have a bad result and they'll be upset, right? An injury, a bad performance. But the thing that I've noticed is they will do the same level of depth of analysis if it's good or bad, right? And they're unemotional about that process of going deep on the feedback. And
they don't get attached to the emotion itself.
No.
They're able to, like, obviously enjoy and value the good outcomes or experiences you have, but also don't get so attached to the emotion that you forget to think about what actually led to this outcome.
I think one of the things that's interesting, and this is probably a practice that I believe is probably something that you can encourage people to do, whether it's as a health professional, performance professional, is get really used to doing a lot of internal, review and feedback, where the feedback conversations, whether that's with yourself or externally, whether it's journaled, becomes so consistent and so extensive that you're going to write down the result, whether it's good, bad, or indifferent. So you have a very good way of understanding what behaviors and what thoughts were going into that. And for those people who watched the Olympics and, became really, a popular kind of thing to bring up. But Nicola McDermott, she's now married. Her name's now Nicola Ollie-Slagers. But the high jumper, she won the silver medal, jumped over 2 meters consistently, great jumper. The thing that she does, the moment she walks off the mat from the jump, whether she's made it, whether she hasn't made it, she walks back, she pulls out her training diary, and she writes in her diary, she gives herself a rating, and she writes what happened, what didn't happen, what she felt, what she didn't feel, what she thought.
Yeah, wow.
Right? And it became a big thing after the Olympics, her pulling out a little book while she's sitting there waiting for her next jump, writing in it. That to me shows a behavior of an extremely high level performer who is willing to actually go through that review process consistently.
and actually build up a habit. Because I think that's the other thing too that, I mean, and we all do this as part of being human, of you go into potentially positive but also negative cycles in your head for whatever reason, but identifying what is that trigger, but also then identifying and being able to observe when that happens to then be able to be much more objective and reflective in the process. It's
great that you bring that up, because talking with Marco, and also actually I mentioned this to your brother, we were talking about music, and he brought up, and I said to him, have you ever heard of Phil Jauncey, who's a performance psychologist? And I remember watching a few videos and a podcast of him talking about, as a performance psychologist, your job is obviously to get outcomes. It's not so much about diving, and people correct me if I'm completely wrong and off mark here, but it's not so much about trying to correct the emotional feelings that you have. It's more about trying to make sure that the behaviors that you have actually match the performance that you want. So one of the examples that he gave was he was working for the Australian cricket team for a long time, and he had a bowler come up to him who'd been given his selection for his first test match, and he went up to him and said, "Phil, I'm shit myself. Like I don't want to stuff this up." And he said, "Okay, what behaviors mean that you usually bowl well?" And he said, "Well, when I bowl well." He said, firstly, I think it was when you bowl well, he said, well, I rush back to my bowling mark and I run in as fast as I can. And he said, okay, what do you do when you don't bowl well? He said, I kind of walk back slowly to my mark because I'm thinking about what I'm trying to do, and I'm a little bit tentative with the speed that I come in at. He said, okay, well, do you get nervous? And he goes, yeah. He goes, I'm nervous now. And he said, well, you're going to be nervous, right? You're going to be out there in front of thousands and thousands of people on the MCG or whatever it is. Like, you're going to be packing bricks, mate. So don't worry about whether the nerves are there. They will be there. Just rush back to your mark and come in as fast as you can. And I think in his first innings, he took 4 wickets or something like that, had a great debut.
Yeah.
And it's a prime example of the behaviours that we have. Sometimes we'll be able to change some of those thought patterns rather than the other way around, even though most of us think you've got to have the thought before you have the intention to then behave in a certain way.
Yeah, and highlighting that the idea, I mean, some people probably have this ability, but the idea that you can just control your mind.
Yeah.
It's like, actually, I know Jonathan Haidt talks about this in The Righteous Mind of, what is it? The mind is the elephant, and what was the analogy you used with the elephant and the rider?
I don't remember exactly.
Yeah.
Actually, I do recall briefly what you're mentioning.
I've just stuffed that one.
Yeah, it's like the conscious mind is like the monkey that sits on top of the elephant.
Yeah.
Right, and everyone hears the monkey, but most people don't notice the subconscious, or for him, it's obviously your value systems are the elephant. And so we see the top surface, but actually there's so much underneath it.
Exactly, like just highlighting what happens for everyone, that we, unfortunately, for better or worse, are so controlled by the networks that have formed within our conscious over over our lifetime. And so in those situations, it's like, well, what are the parameters that you can control? In that situation, it was the simple physical parameters of, well, that you're running back to the mark and running in fast are things associated with it. You can control those physical parameters a lot more than the mental parameters of, holy shit, I'm really nervous. I've got to make sure I perform well.
Yeah. So like putting those two pieces together, I think is a big part of getting along the way. Like we said, review processes. The review process is probably for you to work out what thoughts and behaviors tend to lead to better performance, and then creating, say, like plans going in to make sure that you're trying to execute on those, and then seeing what the outcome is, and then reviewing that, and then tightening that loop over time. So, for instance, if you continue to have, say, hamstring strain injuries playing football, if you're willing to review that and say, okay, well, it tends to happen when I haven't trained much during the week with my local footy club, and I went out for beers on Friday night and I didn't get much sleep, and that's when I tend to get injured, then you go, okay, well, next time I'm going to try not doing that when I return, and then review, okay, did that work? Yes, that worked. You strengthen that behavior, and as you said, it becomes a bit of a habit of not only the review and not only the implementation of the planning, but also that you then use those behaviors, and you start to associate that positively with the performance outcome and the reduction in injury risk.
Yes. And I think then over time, as you potentially alter the behaviors or you alter your perceptions and you start to have positive experiences, your prior memories start to then change and shape how you view yourself in that context, and therefore leads to a greater probability of better outcomes in the future. And I think that's where we need to consider when you think about performance or positive outcomes in a particular context. It's essentially a probability, and that probability is based on many things, both physical and non-physical. And so the more you can start to develop positive experiences, the more you can then change your perceptions and therefore lead to potentially better outcomes moving forward.
I think one of the things that is valuable in this process is to actually physically write it down or record it. I know that there's some resistance from the discussions that I've had with people, but it's something that even, like I think that when we spoke with Paul Coburn, and he's talking about, objective measures, making sure that we have outcome measures that are being done regularly enough so that you can demonstrate to someone, well, at this time you said your pain was 7 out of 10. Where now, 2 weeks later, it's now 3 out of 10.
Yeah.
That's your reporting. Understand that now, even though it still hurts and you're telling me it's still affecting your function, there's a significant change in this. And in discussions you often have with people, because of that psychological discomfort of that review process, they don't necessarily want to go to the behavior of writing it down, or putting, a score somewhere on an objective measure. But that is actually very valuable.
Yeah. And look, there's a saying I've heard, it sounds quite pessimistic, but the saying is, the mind is a drug. It is against that which is. And what it means by that is, and hopefully that's not always the case, I know it sounds rather negative, but in a situation like that where you may be getting positive change, particularly if you've got an injury that's takes 6-12 months to get better from, but you're like, oh, I still can't play footy. It's like, okay, that's true, you can't, but between when I first saw you to 4 months later, we've seen significant improvements in your flexibility, in your strength. You can run, you can do all these different things. But does that person have the ability to objectively identify and see that improvement? Or are they just still like, oh, well, it still hurts a bit, or I still can't play sport?
And I think one of the things that we should encourage is not only the acknowledgement of those factors, but also almost like a celebration of, I've met this next level of, say if an ACL's a common one, it's like, I've now met the level where I can run. That's the next checkpoint for me. There actually should be, both from the practitioner or the health professional or the individual, I'm not saying you're necessarily going to over-celebrate it, but there's acknowledgement and there's going, oh, this is good, well done, you've actually met this next criteria to step up to.
Well, and it goes back to the question you asked before of like, what kind of things can you implement? And the suggestion I gave is, that might be something as simple as, I just want you to do this one exercise. It's going to take you 2 minutes to do and do it every day. And don't actually dismiss the significance that has for a certain person who just doesn't have the ability to, has very poor self-discipline and typically won't do anything. If they do that, it's like, great, that's really good. You've created a positive change. You give them that positive reinforcement, so it starts to develop a new pattern, a new system.
One of the things I think about with that, and I think it's actually really valuable both for like learning, and I think it's very valuable for the way we design performance or even injury management, is designing things where it's within their grasp. And we've spoken before about Vygotsky's zone of proximal development. You want it to be close enough that it's challenging, and you want it to be far enough that it's challenging, but you want it close enough that they will get a certain level of success when they complete that task, so that the motivation that they get from some like improvements in their competence goes up, that goes into, there's, self-determination theory, and which is a motivational theory, but it means that people actually feel more motivated to do it because you set something at the level that is appropriate for them.
Yeah, and I think that's a parameter that should be dynamic in nature, because you might initially for someone have to start with the probability of, I think there's a 99% probability you're going to succeed in this, and it's a really simple task as a result. And so, when they do it, it's like they may not feel that much self-satisfaction, but that's not the point. It's a point of you can see that there is the ability to achieve this. And then that can obviously dial back or forward. And it's like, I know this is actually, again, something interesting that you mentioned with one of your athletes, and I'm sure you've had this many a times, is like, this is what I want you to do for this particular performance, for this particular race, which might not necessarily lead to a good outcome in terms of their result, but they actually start forming the pattern that they need to get to where they need to eventually. But that's actually a process where initially it actually might seem like, oh, I just failed, I just ran really badly, and you go, no, you actually did exactly what you needed to do. Just understand that that process to get to where you need to is going to require a certain amount of time, and being able to be comfortable with knowing that the result isn't going to be instantaneous, because that's another really valuable psychological trait to have, of making sure that you can respond positively to what you may perceive as a negative outcome.
All right, I think we might end this one around here, but I think the key takeaways are that obviously your psycho-emotional state has a big influence on not only your physiological behavior, but often potentially the performance or the outcomes that you get. That if you want to recognize how to address this, you need to be very clear with communication and make sure that communication is in a direction of the positive outcome that you're looking for, that you're willing to review both positive and negative outcomes, and then finally that you're willing to actually act on that to put forward behaviors that potentially amplify the outcomes that you're trying to get.
Yeah, and starting from that simple standpoint of, do you consider that individual's psychological profile or perceptions to be influencing the particular presentation or outcome that they're having? And if so, how do you create that change? And there are obviously times where there are things that you can do to implement positive changes in their belief systems and their perceptions. And there are obviously times you need to think of, well, do I actually need like some more significant professional input to help with this person achieve the actual result that they want?
All right. Thank you very much, Jack.